Okay, and so believe that we are live. Okay, so I am going to get started. Let me see. Able to see you as well. Okay, great. So this is our first meeting. Um, my name is Natasha. I am a registered nurse and nurse entrepreneur, also owner of IKRM, which is a care management company. So what I do is I partner with physicians and nurse practitioners to deliver comprehensive, high quality care management services to their eligible patients who are living with chronic health conditions. I also teach other nurses and nurse practitioners how they can start their own care management company or implement a care management program within their practice. As nurse care managers, we help patients and their families plan for their healthcare needs and ensure that they have access to the resources that are available to them. Today, I will be talking with another chronic care management nurse entrepreneur, Shamika Carter, about what is chronic care management or CCM and the benefits of having your own nurse care manager to advocate and work with you to ensure that you are meeting your health goals. So first, we will talk about what is chronic care management. Well, chronic care management, or CCM, is a service provided to individuals living with chronic health conditions such as heart disease, diabetes, lung disease, or other conditions which may place the individual at risk of complications or deterioration. It provides individuals with a trained care manager who serves as the point of contact between the patient and the medical practice. This helps to ensure that all of the patient's health concerns are addressed and managed effectively. Care management provides individuals with access to the support they may need between medical office visits, allowing them to maintain good health by helping with medication refills, coordinating medical care between multiple providers, creating an individualized care plan, educating individuals on their disease, and empowering them with the information they need to maintain good health. So my co-host today is Shamika Carter. She is a nurse practitioner and also a chronic care management provider. So Shamika, tell me about yourself and your background with chronic care management.
Okay. Hey, Natasha. My name is Shamika Mitchell, or Carter. I'm in the middle of Carter and Mitchell, but Carter. I am a adult and geriatric nurse practitioner. I've been a nurse for the last 26 years. I spent 10 years as a licensed vocational nurse here in California. We call them licensed vocational nurses. I spent 10 years as a registered nurse, and for the last 4 years, I've been a nurse practitioner. I've also spent the last 9 years, since 2013, working as a legal nurse consultant. I have my own legal nurse consulting firm since 2013. I'm an expert witness on medical malpractice lawsuits, but I'm retiring from that effective 2022 so I can focus 100% on chronic care management. As a result of the COVID-19 pandemic, I stepped out on faith and started True Care Telehealth and House Calls practice. March 2021. We are a value-based practice, and we specialize in care coordination, managing chronic illnesses, which include educating the patient and supporting them on their journey to health. We work with other care providers like doctors, other nurse practitioners, registered nurses, LVNs, certified nursing assistants, MAs, and social workers to train them to become care managers in our practice with True Care Telehealth and House Calls. So that's a little bit about me.
Okay, great. So can you tell us a bit about how does a nurse benefit from being a care manager?
Yes. So care managing is a new spin on an old way of putting your nursing skills to work. A care manager works as an advocate for the patient. You work as an advocate for the patient outside of your traditional bedside care model, right? Care managers literally become the voice for the patient in the healthcare system. You become the patient's voice by interviewing the patient, gathering information, and then attentively listening to their needs so you can prioritize them and make sure that you cover everything, whatever they need to live independently and safe outside of emergency room visits, urgent care visits, and long SNF stays. That's what we do. We address all their needs. So that's basically what a care manager is.
Okay, so great. Like Shamika, I myself started as an LPN in Florida 20 years ago, and then I became an RN 3 years ago, 3 to 4 years ago, and I've had many roles as a nurse, and with that knowledge, I decided, well, I began learning about chronic care management a couple years ago as well, but didn't really know how I could break into that field as a nurse. And then I started my business. I knew I wanted to help my community. I saw, a lot of suffering really with not just patients, but just family members having chronic conditions. And so I knew I wanted to use my knowledge and skills to become a nurse care manager. And so that's why I started my own CCM business. And I benefit from being a nurse care manager. I am able to help those in need, as well as educate other care providers on how they can get into chronic care management. So we're going to talk a bit about how CCM can help people 65 years and older remain independent. So for people 65 years and older, chronic care management is part of their Medicare benefit. Medicare developed this program back in 2015 to help individuals with chronic conditions avoid frequent hospitalizations or visits to their urgent care center, frequent visits to those centers as well, and also to help reduce healthcare disparities by increasing access to patient care. Under the Medicare CCM program, eligible individuals with 2 or more chronic health conditions, which are expected to last at least 12 months or more, or until the death of that patient, can receive CCM. Chronic care management, or CCM, is able to help individuals 65 years and older remain independent by giving them access to 24/7 access to trained care managers who are able to help coordinate their care. We work with patients and their families to help them with appointment scheduling, referral follow-ups, medication review and refills, educating them about their disease, identifying any gaps in their care, and providing them with the knowledge and resources to gain the confidence they need to better manage their health. Because as nurses, we advocate for these individuals as part of their healthcare team. As a nurse, I use my knowledge and over 20 years of experience as a nurse in long-term care, in hospice, and in all of the roles that I've practiced in over my nursing career. And I use that to get started with my CCM business. So who can start a CCM business? So if you're a registered nurse, a nurse practitioner, medical doctor, physician assistant, or an LPN, you can start a CCM business. In some states, health coaches and medical assistants are able to start a CCM business. But it is important that anyone starting a CCM business follow their state guidelines and function within their scope of practice. For example, in most states, LPNs are not able to develop a comprehensive care plan, which is a requirement for delivering CCM under Medicare's guidelines. However, LPNs are able to gather information for the care plan and have an RN develop that care plan. Nurse practitioners in independent practice states can offer CCM to their eligible patients as an additional benefit, and they are able to bill Medicare directly and receive payment for their services. Medical doctors can partner and contract with nurse care managers to deliver the CCM services to their patients, or consult a nurse care manager who can implement the program within their practice. CCM services are delivered under the general supervision of the medical provider. Therefore, they do not have to be present for those services to be delivered to their patients. It's done remotely, so the provider, of course, does not need to be there. The provider collaborates with the nurse care manager, and they bill Medicare and reimburse the nurse care manager for the services provided. So Shamika, tell me about how you deliver CCM to your patients.
Yeah, but just to add on to who could start a CCM practice, there are healthcare attorneys. Of course, the CCM EMR that we use, Prevounce, it was created by healthcare attorneys, and there are doctors, of course, that have added chronic care management onto their practice. Only 11% of the doctors in the United States, but doctors. But I think the absolute best person to have a CCM practice is a nurse, because nurses are direct caregivers, and nurses focus on the social and emotional well-being of the patient. The doctors focus on the physical health and prescribing medications. And then, of course, healthcare attorneys, they focus on winning those medical malpractice cases because that's big money. But nurses, we focus on the whole person. And we do this every day, day in and day out, while we're at work. This is part of our everyday job duties. So I think nurses are the absolute best people to start CCM practice. How do we deliver CCM care to our patients? We initiate a complete comprehensive assessment, which include asking about the patient's social determinants of health, right? So social determinants of health are those things that prevent a patient from obtaining and maintaining appropriate healthcare services. Some social determinants of health are lack of income, right? That's one. Many low-income patients have a delay in care because they skip doctor's appointments. They don't want to, endure that out-of-pocket cost. It costs too much to go to the doctor, or their medication costs too much. I had a lady that couldn't afford insulin. So though that's a social determinant of health. Another social determinant of health is lack of education. The American Academy of Family Physicians found that most Americans only read at an 8th grade level. And then there's 20% of Americans, which is okay, 20% of Americans that read at a 5th grade level. And most or all healthcare information that's written is written at a 10th grade level. So if it's written at a 10th grade level and most Americans are only reading at an 8th grade level, of course they don't understand. Of course they're leaving the doctor's office with questions. Of course they need that extra layer of health. Health literacy, if you cannot understand what's being said about your condition, it's difficult to adopt those healthy behaviors, maintain your health, or effectively manage your chronic conditions. And we all know every day hospitals release patients back into society, but many of these patients go back and forth, readmitted to the hospital with failing health again, simply because they don't understand how to effectively manage their illness. So addressing social determinants of health plays a huge role in helping patients better manage their chronic conditions and achieve care in their wellness goal, achieve the care in their wellness goals that they set for themselves. One way that I reach my patients is I speak 2 languages. I speak Ebonics fluently, and I speak American English. I take the information, that American English, that 10th grade level of health literacy or health information, all these books, and I translate it into a language, layman terms, where people can understand exactly what I'm saying to them. And my first language, which is Ebonics, helps me do that with these. Most people that I talk to, because I'm able to translate the information into a language that they understand, then of course they come back, because you want to be around, you want to associate with someone that's talking to you on your level, not talking above your head or making you feel some type of way. So helping the patient understand on their level is huge in chronic care management. That's one of the major ways that we deliver care.
And that is really very important, because myself, like I said, my mom, she has a chronic health condition. Sometimes she comes home from the doctor and it's like, okay, so what did the doctor tell you? And what medication did they give you? You know, why did they give you that? And it's like, well, I don't know, something it's coming, but you know, she really doesn't know, you know. I'm like, the doctors, not like they don't care. They really don't have that time to put that extra effort in, and they might give you a printout of some information that you're really not going to look at, you know. And so, like you said, our goal is to break it down in layman's terms to make it easier for, for people that have these conditions to understand what's going on, and help them, better manage that. So another question that I wanted to ask you was, how long did it take you to get started in your CCM business, to start providing that service to patients? How long did it take you to do that?
So we know the program is fairly new. The chronic care management program is a Medicare-driven program. It was implemented in 2015. I started doing research in 2016 just because I was working as a director of nursing services in a skilled nursing facility. And for us to get our bonuses, we have to, those short stay patients, we have to help discharge them back to the community. And sometimes it's really difficult because they only get like 100 days inpatient. And within 100 days, they're not ready to go home. So I'm looking for ways that I could help for them. And I came across the CMS CCM program, chronic care management program. So while I was in school and in P school, I was just doing research, just doing a lot of research. Again, back March 2021, I did nurse concierge up until about February. February, I took a class, I took a course, and that kind of pointed me in the right direction. So that's February 2022, took the course, pointed me in the right direction. March 2022, myself and my really good friend that believe 100% in my vision, we got out there and started marketing. We start going to assisted living facilities, senior facilities, and the likes. And by June, I had my first insurance-based patient. And here we are in September. The summer is over.
Yeah.
In September, and I have just about, not a full panel, but enough to take me over.
Right. Okay.
So
great.
from March to June, I had my first insurance-based patient.
Okay, great. And so, like yourself, I had this information that about chronic care management, and I found it really valuable. And I started my consulting business back in September of last year. So it's been a year since I really registered my LLC and all of that to get it going. But like I said, I started my consulting business and kind of began to focus on CCM more towards the end of March, and decided to step out on faith like yourself and approach my provider about whether I could deliver those services to his patients. And he said yes, of course. And so I got moving there. And then I posted in B&E really about me stepping out on faith and starting the CCM business. And I was able to connect with a coach who's actually an LVN who is doing CCM. And she encouraged me to start a course to teach others as well. And she helped me with that. And then as I began to talk more about CCM, I was able to meet two other coaches, and they also helped me on this journey. So I am, starting to consult with providers and contract with them to deliver the service. And so it's been really good for me just getting started. Really, it's been about 5-6 months getting it up and running. So that's about the time frame it's been for me as well. So another question I am often asked is, are you able to start a CCM business as an LPN or LVN? So like I said, my coach is actually an LPN, and she started her own CCM business. And she does that by partnering, of course, with physicians or nurse practitioners in independent practice states. And though there are some limitations with the scope of practice as it relates to developing a comprehensive care plan, she has hired a registered nurse to help her with that part of the business, but she is still very much in charge of the whole CCM practice. She just has the registered nurse to help with that aspect. Another question I get is, do you need a medical director to run a CCM practice? And the answer to that question is no, you do not need a medical director. You do need a medical provider that you will partner with to deliver the service to the eligible patients, because as we discussed, CCM is delivered under general supervision. Therefore, the provider does not have to be there for the CCM services to be delivered. So Shamika, tell us more about how do you get patients and market your CCM business?
Hey, your coach told me back, I met her too. I hadn't met you yet, but I met your coach, and I just called her. I said, can I talk to you? I have some questions about chronic care management. And she said, sure. So she took a call from me and we had a conversation, maybe 30-minute conversation. And she told me, listen, don't you stop. The reason you're having so many